The World Health Organization is keeping an eye on a novel COVID-19 subvariant known as xbb.1.16, which has been circulating in India for a few months and is generating a new wave of infections. The Times of India reports that more than 3,600 new COVID cases have been reported across the country since the day before. This is the most cases that have been reported in a single day in India in more than 6 months. In India, xbb.1.16 has replaced the other variations in circulation, said Maria van Kerkhove, who's COVID-19 technical lead, at a news briefing on March 29. So this is one to keep an eye on. According to the WHO, xbb.1.16 is one of over 600 Omicron subvariants currently in circulation. It's comparable to the xbb.1.5 strain that has dominated the United States since 2023, but it's characterized by a spike protein mutation that may provide it some additional growth advantages. Van Kerkhove says that lab tests show that this new mutation shows greater infectiousness and possibly more pathogenicity. There are prospective changes that we need to keep an eye on. xbb.1.16 has so far been discovered mostly in India and Nepal, where at least 10 cases were confirmed on April 3. Nevertheless, as we've seen with previous versions, things can change quickly. Consider, for example, xbb.1.5, which accounted for fewer than a fourth of COVID-19 cases in the United States as of late December last year. If the new variety makes it to the United States, the question is whether xbb.1.16 will do the same, or whether the two are closely related enough. Still, a novel variety, even if it increases case numbers, is not cause for concern. We haven't found a shift in severity in individuals or populations, says the researcher. Even though the number of cases has gone up, hospitalizations and deaths in India have stayed low. In response to the new common variation, Indian health officials have given extra boosters to people over 65 and those who are immune-compromised or otherwise vulnerable. Because many countries now have high levels of population immunity, she believes that increasing the number of those who are vulnerable at the start of a wave of cases is a dependable and repeatable technique. Any new Omicron subvariant doesn't bother us. It doesn't change the baseline recommendation, which is to help older and more fragile patients. There's a chance we'll get very unfortunate and get a worse variety, and then we'll boost everyone. But we know this isn't what xbb.1.16 is because it's causing the expected rise in cases without a significant increase in hospitalizations. It's been a year since the WHO presented its 3-part plan for getting the world out of the emergency phase of the pandemic. Despite the creation and dissemination of variants like xbb.1.16, the globe remains on the best-case scenario path, in which new variants continue to evolve but do not generate outbreaks with high incidences of severe disease and hospitalizations. Since xbb.1.16 is no longer one of the Omicron variants that cause infections in the US, health officials should think about letting vulnerable people who were among the first to get the bivalent boosters in September 2022 get another one. Concerned about the dismantlement of independent tracking operations on which the US has relied to detect and monitor new varieties before they become prominent as the virus evolves, she said, "I think we're letting down our guard."